Once that was passed and the abortion law was changed in Idaho, we are no longer allowed to deliver earlier for these unfortunate circumstances where we know that the baby's not going to survive after delivery. If your water breaks, say, at 16 weeks, what a lot of people don't realize, there is no lung function. So these babies there's no chance that they're going to be able to breathe properly. Whenever that sac ruptures, then, the entire uterus is exposed to all of the bacteria in the vagina. So they have a very high risk of infection. And in these scenarios, knowing that the baby's not going to survive and your high risk of infection and sepsis and death, we were able to counsel these patients that, hey, you have two options here. You can continue your pregnancy and know that these are your risks and know that your baby's most likely not going to survive, or you can induce early to decrease this risk of infection, sepsis, and death. And so now we're no longer able to do that. So if they want to induce early because they know that their babies are going to have no lung function and they have a very, very high risk of infection, we have to send them down to Salt Lake to be managed. And, that's a huge thing. Like, you work here, you have your other little kiddos here, they're 2-3 years old, and your support structure's here, your family's here, and you're having to go all the way down to Salt Lake. It's terrible. And sometimes your insurance doesn't cover it. I had one patient who decided her baby had no kidney function, and she decided she wanted to go to Salt Lake, and then her insurance declined it.